Namaste. Globally, 70% of new HIV infections are among people who are marginalized, and only 52% of children living with HIV are on life-saving treatment. The theme for this year's World AIDS Day, Equalize, highlights the urgent need to address the persistent inequalities that have stalled the progress in the global response against HIV and AIDS. People living with HIV continue to be subjected to prejudice, discrimination and marginalization. AIDS will continue to remain a global health crisis unless the structural barriers and inequalities that perpetuate AIDS are removed. On World AIDS Day, WHO calls on national leaders, policymakers and all partners to work towards strengthening policies and programs to address the inequalities that are at the core of uneven progress and to equalize access to essential HIV services. Our efforts must be focused on reaching populations that are vulnerable and key to the HIV response, including children, men who have sex with men, transgender people, people who use drugs, sex workers and prisoners. Nepal has set an ambitious target of 95, 95, 95 by 2026. This is to diagnose 95% of people living with HIV, to initiate and retain 95% of diagnosed people on antiretroviral therapy and virally suppress 95% of patients retained on antiretroviral therapy. Nepal is also committed to eliminate the vertical transmission of HIV and syphilis from pregnant women to their infants. This is a demonstration of strong commitment from the government of Nepal. Achieving these targets requires multi-sectoral collaboration, commitment and response, as the health sector alone cannot address the underlying social, economic, cultural determinants that perpetuate the inequalities surrounding AIDS and people living with AIDS. Let's act now to ensure everyone, everywhere has equal access to HIV prevention, testing, treatment and care. Thank you.